Hi, everyone. My name is Dr. Michael Wald, and welcome to this brief but I hope concise and practical conversation about sleep maxing, entitled Sleepmaxing for Life. Again, my name is Dr. Michael Wald. I've been in the holistic field of healthcare for over 30 years. I currently practice in Chappaqua and Westchester and Richmond, Virginia. My contact information you'll find on the first and the very last slide. So let's begin this topic first with just a brief disclaimer that this information is for education. I don't know you, so I can't give you specific sleep maxing advice or any health advice for that matter, so be careful. So let's discuss what sleep maxing is. Basically, it's the practice of optimizing sleep to achieve the best possible rest and recovery, and that'll enhance both physical and mental well-being. Now, I must tell you, for someone who's been in holistic practice for all these years, probably one of the most common errors that I've seen people make, even really seasoned people in the natural healthcare area, is they have a very heavy focus on exercise, they have a very heavy focus on diet, a very dramatic and heavy focus on nutritional supplements and other lifestyle practices, and they know that sleep's important, but they don't actually really take a mindful look at their sleep issues and how to maximize sleep. And you can't heal without sleep. Sleep and rest are essential for the healing process and to reduce disease risk. So it's important to take this seriously, not just some passe, oh yeah, I know sleep is important, I got it, next. That's what a lot of people do, and they wonder why they're not getting well. They're doing everything right on paper, just not the sleep. So sleep maxing involves creating a sleep-friendly lifestyle by improving factors like the environment in which you sleep, your various habits that lead up to when you sleep, and overall nutrition. And the term sleep maxing is often used in wellness and productivity circles as a way to emphasize the importance of sleep in achieving peak performance, energy, and overall health. I've taken people that have done the right things health-wise, but not sleep, and when we implement proper sleep practices, it is dramatically obvious how sleep was the missing factor. So why, again, are people practicing sleep maxing? A few things I want to emphasize for you right now. Number one, you'll just recover better from illness. Maximizing rest helps muscles repair, helps the brain recharge, it helps the circulatory system. You name it, sleep is dependent on it. Mental clarity. High quality sleep improves focus, memory, and decision making. And they've done studies that show that a lack of quality, deep, stage 3 REM sleep throughout your life will increase your risk of dementia, cancers, heart disease, even diabetes. Energy levels obviously are going to be affected by sleep quality. Waking up refreshed boosts daytime productivity, to say the very least. And then your overall health benefits from sleep maxing. Sleep influences immunity, metabolic rate, overall metabolism and physiologic function, and mood regulation. I've seen people with anxiety diagnoses, ADHD, ADD diagnoses, depression, and all they needed was proper sleep hygiene education. So in short, sleep maxing is about making sleep a science-backed priority to enhance every other aspect of your health. So we want to prioritize sleep, recognizing sleep as a non-negotiable part of your lifestyle, as important as drinking water and brushing your teeth. We want to optimize the sleep environment, maximizing the bedroom in terms of the amount of light, making it as dark as possible, as quiet as possible, cool and comfortable to maximize restfulness. We want to tailor your sleep needs and recommendations, because in my field, customization and personalization is everything. And we all don't respond to the same sleep advice. And then there's using science-backed tools, so incorporating strategies such as blue light blocking, which I'll discuss a little bit further in a moment, sound machines, and biofeedback. All have been shown to improve sleep quality when used the right way for individuals. So I mentioned this blue light blocking basically involves reducing exposure to blue light, hence blue light blocking. Because we know that blue light, which we get from cell phones, computers, TVs, artificial lighting, will suppress melatonin production, which, as most of us know, is an essential hormone for our circadian rhythms or our sleep cycle. So to counter that, people use blue light blocking glasses or enable device features like night mode to minimize exposure by limiting blue light. So there's a lot more we can say on this. Perhaps we'll discuss that more in a future talk, but I want you to be aware of blue light blocking. And then there's biofeedback techniques. Biofeedback is a wonderful technique that helps individuals monitor and control a variety of physiological functions, such as heart rate, muscle tension, breathing. It helps reduce stress, relaxation, and it improves the wavelengths in the brain, which are ideal for sleep. So during feedback, you learn how to promote those sleep-friendly brain waves so that when it's time for you to practice your sleep hygiene practice, as you move towards sleep the last few hours of your evening, you'll start to teach your body to get in that circadian rhythm. And then you can turn on voluntarily those powerful sleep brain waves because you've learned how to do that during biofeedback. And then there are devices like wearables or apps that provide real-time feedback on biofeedback metrics, teaching users how to calm their nervous system. So for sleep, biofeedback can help lower stress levels, activate the parasympathetic nervous system. That's the nervous system you need active for repair, sleep, and rest. So over time, the practice of biofeedback helps develop healthy sleep habits in some of the worst insomniacs, in my experience. So some core principles of sleep maxing that you should be aware of. Number one, again, I just want to reiterate, you want to maximize and optimize that environment. You want to be consistent and have a routine with your sleep habits. You want to manage your stress. You want to adjust other lifestyle issues that might be interfering with your sleep, like the consumption of caffeine late in the day or using screens before bedtime. And then there's nutritional support, often underappreciated, especially in traditional medicine, incorporating certain foods and nutritional supplements that promote sleep. And I'll discuss some of those in a moment. And then, tracking and analyzing your sleep efforts. That can all be done now with easy to implement technologies right on your smartphone. So here's just a couple of different nutrients that you might want to think about. When I work up a person using my blood detective biochemical workups, I can help identify exactly the problems with their chemistry, which then tell me what foods and nutritional supplements and doses I would use with them. But these are some of the more popular ones. Most people, unfortunately, use these wrong. For example, melatonin. How much melatonin should you take? When should you take it? Have you heard that if you're waking up in the middle of the night, that maybe having melatonin next to your bed might help? But if it's a tablet or a capsule, taking that requires water, and that can create more wakefulness and actually undermine you taking the melatonin. So how about taking melatonin in a liquid form, and when you wake up, put it under your tongue, close your mouth, go to sleep. So these little adjustments that qualified people know regarding sleep can make all of the difference. And the dosing, again, depends on the person. Then there's magnesium. There's different forms of magnesium that would determine when and how they should be taken, perhaps with other nutrients. But overall, magnesium is a parasympathetic nervous system stimulator, which means it relaxes the nervous system. L-theanine, it's an amino acid found in tea. It's known to promote relaxation and reduce stress without causing drowsiness. And of course, there are concentrated supplements of L-theanine. There's valerian root and ashwagandha. They're both herbal supplements, and the ashwagandha is adaptogen, all for helping to balance stress levels in the body and help improve sleep onset. In addition, there's 5-HTP, which is a precursor to serotonin and melatonin, which may help with sleep regulation. So when I work up someone's biochemistry and I go through their whole medical health history and I decide what nutrients and overall lifestyle improvements they might need for all of their health, that might tell me the best of these particular nutritional and natural sleep aids that fit their needs in other ways as well. So there's GABA, gamma-aminobutyric acid, a very underutilized drug. It's also available in health food stores. You want to get a pharmaceutical grade form of GABA. It's generally used in medicine for neuropathies, pain, for sleep, depression, and anxiety. Very, very good a safety profile, and you can use very high doses, but again, under proper supervision. So GABA is a relaxing neurotransmitter, as I've said, which reduces the time it takes to fall asleep. And then there's passion flower and chamomile and cannabinoids. These various nutrients help everything from reducing anxiety to promoting relaxation and overall sleep in individuals. So in summary, we want to approach any improvement in sleep with a health or holistically minded approach. We want to look at everything that may be involved in a person's lifestyle that may be impairing their sleep and adjusting those things for that person. And then we want to treat this sleep management as a healthcare effort as opposed to disease care. That means we need to look at the person with these sleep issues on a fairly regular basis and make sure that we're personalizing all the recommendations at every step of the way and making sure that they work by looking at the biochemistry that may have been wrong, which also set the person up for sleep problems. If they have low melatonin levels, they may have very high cortisol levels or DHEA levels, another adrenal hormone. Maybe they have an overly sympathetic nervous system, which will keep them awake. So we have to test and make sure that as a person's sleep quality is improving, all of these other biochemical issues with their chemistries are also improving so that we get long-term benefits. And we want to provide nutritional supplementation based not on the recommended daily allowances, the RDAs. The RDAs represent governmental guidelines, for those of you who don't know, that represent the minimum amount of that nutrient to avoid a deficiency disease, not the optimal amount of that nutrient to promote health. So a healthcare blood detective approach is going to use the right dose of the nutrient for optimizing health, not some minimal amount. That's why when your doctors look at your supplements, they'll look at it and say, oh my goodness, this says it's 1,000 times the recommended daily allowance. Oh my God. It's really embarrassing. The average medical doctor has something like 19 to 23 hours of nutrition education in their entire medical curriculum, which means anyone watching TV commercials about food knows more nutrition than their doctors. Not a joke. And then there is doing the right testing on a person. But in medicine, you go to one specialist, they do their little group of tests, then you go to another specialist and another one, and they do their little groups of tests. No one talks. But in the blood detective method, I can do testing from any medical specialty at once. And why would we want to do that? To be consistent with a holistic approach to improving sleep and improving health, so we look at everything at one time. It's all of the pieces of the puzzle. Thank you so much for joining me today for this, I hope, useful talk about sleep, and I hope to see you at a future presentation.